Hello, and thank you so much for this opportunity. I'm excited to be here. I've been coming for a long time, and I've done a lot of observing and listening and learning, and it's just really been a privilege to be a part of this group. I feel really lucky to be here. Today I want to talk to you about a concept called the Pilates bridge. What do you do, or what types of exercise programs are you recommending to your patients if there's an opportunity?
Go to physical therapy.
Go to physical therapy.
I always pick the one that they're more likely to do, the one that they're motivated to actually go to.
And how do you recommend that, and how do you decide?
I usually just ask them questions like, what do you actually love to do as far as movement? Whether it's, tennis or Pilates or dance or yoga, whatever it is, like most people enjoy some sort of movement. So if we can kind of pattern it, customize it off of that, they're a lot likely more to do it.
Right. Do you have certain places that you recommend they go to? Or do you have connections with movement specialists other than physical therapy?
We have a whole database of different gyms for
Awesome.
every clinic. So we have like gyms that it's just like a database where they can pull and like they have personal trainers that we connect them with. So we'll text the personal trainer before they're done with therapy, and we'll say, hey, this patient's 2 weeks from graduation, can we get them in your gym? And we try to just make that connection early on.
So making that connection early on is a big part of creating kind of a seamless bridge to helping people get back into movement. Because a lot of people don't have to be dancers or huge movers to just be good movers. And that's one point I want to draw out with Pilates and what we're going to talk about today, and a couple of other things. Okay, has anybody been on this equipment before? Awesome. What has been your experience? First here.
Harder than it looks.
Harder than it looks, okay.
It is harder than it looks. It probably requires a little bit of instruction. It's not just perfectly intuitive, but it seems like it gives a really good stretch at the same time as muscle strengthening, so it's kind of a combination of both.
Okay, really great assessment. One of the things about the Pilates equipment, first of all, I know a lot of times people will start out and say, Pilates, yeah, go do mat exercises. Sometimes mat exercises aren't the best go-to initially, because if somebody has back pain, a lot of those moves are very core focused, but it's a lot of open chain, and sometimes people's backs can't handle that. And so working on the Pilates equipment can actually provide support as well as load and challenge people. So understanding that difference is really important as you're recommending if you want people to go to Pilates, which we want everybody to go to Pilates, right? This is the Cadillac. This is used more in a rehab setting. This is the reformer. It works on spring tension, so it's got a box sitting on here, but initially you start laying down, pushing against this bar against spring tension. There's lots of different ways and planes of movement that you'll work on this apparatus. This mimics this with the reformer. It's kind of fun. This is a mat that converts onto here, or people just do it on the ground. This is a ladder barrel. Ladder barrels are awesome. They provide that arc that's natural to the spine, and it also can provide a lot of support. If somebody has a hard time with extension, a lot of times I'll put them over this and they can actually work from extension from where they're at instead of just feeling like they need to be prone to start. So there's some options in range. This is the chair, very deceiving, can be very, very tricky, but again, works on an arc of the joint motion. So it can be very, very gentle. This kind of mimics this on the floor. So these are all different types of equipment that can really provide support or help challenge the individual. Does anybody know who this is? Good job. This is Joseph Pilates. So the science of contrology, which is his method that he created and the sequence of exercises that he created, which is Pilates, disproves that prevalent and all too trite saying, you're only as old as you feel. The art of contrology proves that the only real guide to your true age lies not in years or how you think you feel, but in actuality are as infallibly indicated by the degree of natural, normal flexibility enjoyed by your spine throughout life. If it is inflexibly stiff at 30, you are old. If it is completely flexible at 60, you are young. So the root and original exercises were created out of the idea that if you keep your spine moving and use the correct muscles to move your spine, then you're going to stay young and you're going to keep your body working in that, hopefully you're working towards longevity. So this is him at age 57, and this is him at age 82. Like a pretty good stallion right there. Look at him, feeling pretty confident there. Some of the history, just a little bit about Pilates, I'll tell you just quickly. He suffered from rickets and asthma as a child, and so he had these physical challenges that he wanted to still move and be strong. So at a very early age, he started observation and just creating these exercises that really were based on core strength. But Pilates works the entire body. He brought his method, he really developed his method being interned at an internment camp off a little island off of England called the Isle of Man. And he taught all the people that were interned there as an exercise specialist, and that's where he became a great teacher. And once he got out of the internment camp, he was actually did acrobats and was very, very physical. He was a circus performer. That's how he ended up in the internment camp. He came to New York City, worked with a lot of performers in his New York City studio, and really developed his method. He really tried to break through the medical community and was unsuccessful. They didn't want to listen to him and did not think his concepts were very smart. But he pushed through and he taught people, and those people taught people, and those people taught people, and now we're at over 100 years later with a method that is really booming. So he's a smart guy and a character, as you can see. So studies show Pilates is very studied, and most of the studies that I read are pretty connected to his original method. Pilates has changed a lot over the last years, and that's important to know for you guys if you recommend Pilates, because his traditional method, they're coming away from more and more because we know more. So it's a good thing. There's a place for it all, right? But recommending that your client go do Pilates and just say, go do Pilates, sometimes isn't the right answer. We need to know the differences. So some of the studies that I was looking at, definitely it's beneficial towards the elderly. That this first one with the decrease in depression and an increase in flexibility and timed up and go tests. The pregnant tend to be pregnant people aren't directed as much as they should be. And Pilates can be a great place for pregnancy, especially with all that we know about pelvic floor and ways to strengthen your core during pregnancy. More and more, we need to work out the abdominals as women are pregnant. And Pilates is a great place to do that. So many studies on low back pain. And I love this because multiple times in here, what do you guys recommend for low back pain? As an exercise modality.
I recommend yoga a lot.
Yoga. Why?
Flexibility, mindfulness, and then core strength.
Awesome. Which Pilates and yoga a lot of times are associated as the same thing. I think the apparatus and the equipment set it apart a little bit. Most of his exercises are pretty much core, but they work dynamic stretching too. But similar but different, right? And then this last study that I looked at was they went in and basically educated people on pain and what pain is and what's good pain and what's bad pain. And then they gave them a series of Pilates exercises, and there was a significant increase in positivity there. Okay, so I've broken the Pilates down into 4 different types, and there are more than this, and you'll find subtypes and different ways that people teach everything. Traditional Pilates, does anybody know or has experienced different types of Pilates or would know the difference? No? I'm so glad I'm doing this today then. So all Pilates is claiming to give you good posture, flexibility, and strength. And I would say overall that is the goal of all of Pilates instructors out there. But traditional Pilates really pulls towards his original method. It's his original exercises. I would say probably up until about 2008, probably the most studied, because the trademark was lifted in 2008, and so things changed a little bit more there with what was considered Pilates. Contemporary Pilates, so I'm STOP Pilates certified. Marathon is the name of the company that I certified through, and they took the Pilates method and they brought all these medical professionals into it, PTs, and got their angle on how can we make these the most biomechanically sound. So contemporary, they kind of broke away, but it brought all these ideas and ways of teaching Pilates that was really good specifically for that body, for your body, in a way that aligns with a lot of alignment principles, which I know not everybody thinks that is the best way, but working with the core and teaching people how to move their core, alignment is really important because the sensations in the core sometimes don't feel the same as the rest of the body. And so getting people to have that mind-body connection, that they're actually moving their core from the right place and they're not always just pulling into what they're used to doing, it could just be a really useful tool. Rehabilitative Pilates, a lot of mostly physical therapy professionals use rehabilitative Pilates, and that just brings all of your knowledge and puts it in these exercises, and it's an incredible combination. And then fitness Pilates is what you're seeing more marketed now. Totally a place for it. It's really fun. But I would not recommend that this is where you start out your people who have had back surgery or joint replacement or maybe have scoliosis, or just because you might find a Pilates instructor there that knows how to cater to that, but when you're in a group of 10 to 12 people, it's just harder, I will tell you from experience, to dial in on that one person. And so a small group setting is just better initially. But working into this, so fun and so challenging, and can be a great place for a lot of people, and a lot of people love it. So some clients that I've been working with. So I have a 43-year-old with cystic fibrosis. A lot of challenges there. What can you imagine being some of the challenges? She's done physical therapy. She's had some shoulder surgeries. She needs to get back into physical strength. She's actually going back to have another surgery. What can you see being some of those challenges working with her?
Range of motions can be an issue.
Why?
Because of her, the makeup of the stuff she's struggling with, like at a cellular level.
Right. So like some laxity in the joints, hypermobility, for sure. Anything else? So closing the chain with her and giving her things to push into, she actually can feel her body. And it's so great. The breath component, Pilates, one of the main focuses in all the different types of methods is breath and teaching people how to find their deep core. And it just provides a whole bunch of psychological components as well. Really good. And it's really helping her, and it's giving her core strength so that after her shoulder surgeries, she could sit up out of bed and she didn't have to use her arms, and it was so helpful for her. The elderly, how could Pilates, just from what you know, how could Pilates be helpful for the elderly? Just from what we've learned today.
You can adjust the intensity level.
Love it. Yes. To make it harder or easier in ways that are pretty dynamic. get loading something eccentrically with a very light load can give sensation to the muscle that some people don't usually feel. Brandy.
Like you said, there's a lot of mind-body connection there, and so probably more awareness and pretty good for falls prevention.
Yeah, very proprioceptive. We can get their legs behind them, you know, and get them in positions where they feel supported, they can hang on to things. Yeah, it's really, really good. Neck
Posture too, like everything we do is forward, like opening doors and, you know, we come forward, and my parents are coming forward as they age, and I'm like working on standing tall, putting your shoulder like this positions them to get that muscle memory back.
Right. I have a lady that I've been working with for a while, and I put her down flat and her head couldn't touch, right? She's so kyphotic. And so I put a ball under her head for about 2 months. She's been doing twice a week. She can lay flat. And it's awesome. She's so excited about it, and she can feel her core in different ways, which we're still getting there, but it's so helpful. Just that very concept of the forwardness. And I love getting people into their backs. People don't realize their backs are part of their core, you know? And so getting people into their backs in a way that's pretty safe, and I can communicate with them and say, how does this feel? What do you think about this? I feel it here. Okay, do this and adjust and find what's best for them. Good. Did I have anybody else? Yeah.
I feel like it's a pretty good bridge, both physically and psychologically as well. I feel like having osteoarthritis at 22 years old has made me like not want to work out a whole lot, and so just starting with like stretches and kind of basic movement to kind of strengthen those muscles kind of helps kind of bridge into working out a little bit better.
Yeah.
Having more physical activity.
I love that. It kind of gives you some confidence to be able to move into the next thing. Really, really great. Neck and spinal fusions with people like that, sometimes the mobility just isn't there through the spine, and they might get hypermobile top to bottom of where that fusion is. And so being aware of maybe sometimes working all that motion in the spine isn't the best thing. And so just giving them boundaries around what is safe and what's going to be best for them. I think there's that opportunity with the small group Pilates. I had a patient who actually came from Dry Creek, and she had fractured her L4, L5 by jumping off a waterfall, and the pool was too shallow. And so she went through awesome therapy through Dry Creek and had a great experience there, graduated to Pilates. We gradually brought her into back strength and core strength, and then gave her that overall periphery of strength, or worked into it in that way. And she's back to running. She just ran a half marathon 2 weeks ago, which is awesome. The pregnancy population, I kind of talked about that. I have a 17-year-old with scoliosis. She came in with a lot of neck pain. And so we couldn't really lift her head in the very beginning. She doesn't have any injuries, you know, she's young. But coming into that neck flexion was something we kind of had to work into slowly. And so building the core strength without moving the spine, just teaching her pressure, inner abdominal pressure, and getting her spine to move in flexion, extension, lateral flexion, and rotation just enough that she felt her core. And now we're to the point where we've got supported head strength, and now, or we went to supported head work, and then now she doesn't have neck pain. And so it's coming through movement can really help people be just really, really good movers. As you think about where you send your patients, physical therapy for sure is like the best step and is going to be the next step. But if you get that opportunity to give them a bridge, give them an idea, give them something that they could do next, I think that's super helpful. And it also shows that you care about them. I think they will listen to you more when you give them that option, because a lot of times they flounder, they don't know what to do. And Pilates can be a great option. Thank you.